guest from MMC. I'll go straight to the questions. Okay, I have 3 questions for you, Doctor. On July 1st this year, Ministry of Health has decided to put a freeze on new nursing courses in Malaysia and have the current institution emphasize on the quality and performance of their students. Currently, we have 16 IPTS, if I'm not mistaken, offering medical degrees, with the latest being City College. With the current rate of production of new medical graduates and talk on surplus doctors in the near future, will MOH impose a freeze on new medical programs in Malaysia? That's my first question. My second question, what are the common shortcomings or problems of housemen, particularly foreign medical graduates, in your point of view? And lastly, will there be enough places for proper housemanship training for new medical graduates in Malaysia in the near future at the current rate of production? Thank you.
Yes, certainly. We are recommending to the government to freeze. So no more medical schools, no more nursing schools, no more dental schools, and no more pharmacy school, because we have just too many. We don't want quantity, we want quality. So we are going to recommend to the government, but this is of course under the auspices of the Ministry of Higher Education, and we are going to fight for it because we have had enough schools. Small countries like Malaysia having more than 25 medical schools, both public and private. It's just too many. We don't want the numbers now, we want quality. Second, any problems with foreign house officers or students who become house officers coming from foreign universities? As far as I can tell, in the majority of cases, there are no problems. But there are certain universities, certain foreign universities, where the students seem to have a problem. And these are the universities where there's not much emphasis on clinical training. That's why just now I saw the clinical skills lab, which is very good. So these housemen who are from these medical schools, they do not know how to set up a drip, they do not know how to take a blood, they take blood, and etc., etc. So we have to spend, our specialists have to spend about 2 weeks to retrain them. But this is from specific universities, it doesn't include those from India. It's from other continents, which I don't want to mention. But these are the only ones who find problem. The others, I don't think they have any problem fitting in as house officers. Proper training. As I said, the training should start now. Okay, you should equip yourself with knowledge and skills now. When you become house officers, you may not have the time to learn as much as you can. Of course, we depend a lot on senior medical officers and specialists. But in this world, God makes all kinds. There are specialists and medical officers who like to teach you. There are specialist medical officers who like to, in inverted commas, like dera you, all sorts of things. So, what I would advise you all is anticipate that it is a challenge to become a houseman. But as long as you're good, you're competent, you're hardworking, you are not indisciplined, you are trustworthy, I don't think anything will happen to you. Granted, some of you may be weak in some aspects, and for those who are weak, not because of attitude, it's just that you are weak, you will be extended for 3 months. But before you get extended for 3 months, you'll be given a viva 1 month before you complete the posting, and then they will ask you very simple questions. Things like, what do you do if a patient has a 45-year-old man with hypertension and a smoking history, has severe chest pain? What they're trying to tell you is, what would you do in a patient with acute myocardial infarct? If you cannot handle that question, or if you say, give him some antacids, then you yourself will beg to be extended, isn't it? Because you're so poor. So only in extreme cases like that, where an obvious clinical condition and you do not know how to handle it, you just have to be extended for 3 months. Alright? But if you are competent, you are good, you learn all the time, you ask lots of questions, you're always there, trustworthy. You know, I tell you, when you are in the hospital, people will know you if you are good. But if there's so many of you, and all of you are mediocre, nobody will remember you. So you don't want to be like the rest. You want to show that you are different. You are hardworking, you want to learn as much as possible. Now, what we plan to do, as I was telling you just now, we are opening up more hospitals for housemanship training. But you must be prepared to be posted all over the place in Malaysia. Problem is semua manja. Kalau anak saya tak boleh lah, kena duduk di Kuala Lumpur, tak boleh pergi sana. Seremban dengan Muar pun susah, jauh. Seremban Melaka jauh, tak boleh. All sorts of things. I tell you, I've had enough problem being DG of Health. You know, DG of Health in charge of the whole health sector. Alright, public, private, nurses, MOs, macam-macam. So do not quibble if we send you to places just to make sure that your training is adequate. If everyone wants to be in hospital Kuala Lumpur, and there are 20, 30 fellas there, what kind of training are you going to get? That is why we want to send as many people as possible away from Klang Valley. We want to send them to Pahang, we want to send them to Johor, we want to send them to Kelantan, Terengganu, Sabah, Sarawak. And you must go. If you don't go, then you say, I don't have enough training experience. Why? It's your choice. So please accept whatever posting. You can ask, your choice. But what we have chosen for you, accept it. After all, it's still Malaysia. It's not Indonesia. It's not Thailand. In England, when I was asking those consultants, do your housemen complain about going anywhere? No, they don't complain, they just go. In Malaysia, kita ni mungkin terlampau manja sangat. Entertain sangat budak-budak ni. So please, be prepared to be posted to places so that you can have good hands-on experience. Ada yang kata, mak saya tua, bapak saya tua, memanglah. Mak saya ventilator, bapak saya going to be a ventilator. All sorts of excuses. But we try to keep husband and wife together, like in case you're married and all that. You know, saya susah lah. So that we try to do. Or, and we don't like you to change. When we send you to a certain hospital, you remain there. Just before I came here, I was looking at appeals from housemen who have done their 4th and 5th posting, nak tukar tempat lain pula. We don't normally entertain them. Complete your 2 years, and then you can go wherever you want to go. But now, as I said, we try to send you to Sabah Sarawak. So we are trying to give you as much as possible. And also now, dulu, the specialists and the MOs will grade the houseman. This houseman no good, this houseman good, no good. Now, we will ask the houseman to grade the trainers. So you can tell us, this doctor never come to the ward. This doctor say he teach me, he didn't teach me. This doctor asked me to go on call, never come on weekends. This doctor, 3 AM I call him, he said, marah I. Things like that. So if you have a child, of course you do it very discreetly. Discreetly, and I know what to do. So it's a win-win situation. Okay? I hope that answered all your questions there.